Okay. Good. Can I just check? Can you see that screen? Yeah, awesome. All right. Hello, and thank you for joining us today for our webinar, providing you an update on the Health Canada approved HyQvia, a new immunoglobulin treatment for Canadians with immune deficiencies. Now that HyQvia is available to patients, Immunity Canada is pleased to offer informational webinars to our members across the country. And we've done one now in the Atlantic, we've done one in Ontario, and today is the Prairies, and then tomorrow we'll be in British Columbia. My name's Dave, I'm the Programs Manager for Immunity Canada, and I'll be your host for today. And I'm joined by Fiona, who you should be able to see in the top left, who'll be providing you with background support today. And before we launch off, just a big thank you to Takeda for sponsoring this education event. And just a very warm welcome to all of you joining us today. We've got about 40 people registered all across the Prairies. And we're joining you from our office in Victoria, British Columbia. And just to say that Immunity Canada, we acknowledge that from coast to coast to coast, we are all guests on the ancestral territory of Inuit, Métis, and First Nation people. Members are encouraged to consider their own position in relationship to the land where they find themselves as part of improving our own understanding of local Indigenous people and their cultures in a spirit of reconciliation. And very quickly, I just wanted to mention that we are Immunity Canada, where we aim to empower Canadians impacted by immunodeficiency disorders to live well. We're a member-based organisation that provides a strong voice for patients and their families, and we work with health professionals and others within the immunodeficiency community who help to ensure everyone has access to the resources they need to thrive. And I just want to say a huge thank you today for our presenters and those who are joining us on the panel. First, I'd like to welcome Dr. Kalicinsky. Dr. Kalicinsky began her practice in adult clinical immunology and allergy in 2000. In 2007, she began the Manitoba SCIG Home Program. From 2009 until 2020, she was a training program director at the University of Manitoba, training the next generation of clinical immunologists and allergists. A large part of her practice is devoted to immunodeficiency. We're also joined by Dr. Sylvain Grenier from Canadian Blood Services, who graduated from the University of Laval in Quebec with a Bachelor of Pharmacy. He completed a Doctor of Pharmacy degree from University of Toronto and joined Canadian Blood Services in 2019 as the Director of the Plasma Protein and Related Products Program, where he has been leading various initiatives to modernize the formulary. He's also joined by Andrew McLeod, who who is the Manager of Stakeholder Engagement for Canadian Blood Services. We are also joined, here we go. We're joined by Kathleen Ng, who is a nurse with 15 years of experience working in Canada and Australia. The majority of her practice has been in internal medicine and acute adult medical areas, where she has taken on many different roles such as nurse clinician and clinical nurse educator. She has also worked for a private medical equipment company covering Alberta and parts of British Columbia in Canada, with the primary focus of providing education for staff and patients. Currently, Kathleen works in the SCIG Home Infusion Program, providing training and education for patients, as well as case management. And we're also joined by Becky Rock, who is a registered nurse with over 30 years of practice spanning Canada and the United States. She began her career in critical care in the areas of surgical trauma and cardiovascular ICU, in which she also held roles in leadership, education, and mentorship. And for over 15 years, Becky led the Patient Blood Management Program for Alberta Health Services in Calgary, Alberta. And between Alberta Health Services and volunteer efforts efforts within the Society for the Advancement of Patient Blood Management. She's worked to support a broad range of PBM initiatives locally and beyond. And Becky fills her remaining spare moments in the great outdoors as much as she can. Welcome, all of you, and again, thank you so much for taking the time to join us. And before we kick things off, I'll finish my introductions, and then I'll hand things over to Dr. Kalicinsky to go over the overview, and then it'll be over to Kathleen and Becky around transition and training. We'll then devote most of our time to the question and answers that you might have. We've had some submitted already. If you would like to participate, that you should all see a button at the bottom of your screen saying Zoom Q&A. So you can just push that and type in your question, and only the staff and the panelists will be able to see that. If you have any technical issues, Fiona is on hand, so you can send us a message on Zoom chat. And just so you know that this is a recorded session, but only our panelists' videos and myself will be seen on the recording. And the recording will be sent to people who've registered and to yourselves, but those who couldn't make it today. Very quickly, we offer an array of presentations developed by health professionals, our members, and others who are invited to serve as presenters. The views and opinions expressed by guest speakers do not necessarily reflect the views and opinions of Immunity Canada. Information provided at events should not substitute advice from your physician or other qualified health providers regarding your medical condition. And with that said, it's time for the main event. So I'm going to quickly stop sharing that screen. And Dr. Kalicinsky, I'm just going to bring your slides up.
Thank you.
No worries. And you just give me a thumbs up whenever you want me to.
All right. Advance.
We go into slideshow. How's that?
That's great. Thank you, David. Hello, everyone. And I guess good morning, good afternoon, depending on where on the prairies you are. As David has introduced me, and thank you, David, for the introduction. And I'm very pleased to be here. I'm Dr. Kalicinsky, talking to you from Winnipeg, Manitoba. I'm an adult clinical immunologist and allergist, and you heard all the details from my bio. So I'm going to talk to you a little bit about HyQvia. So title of my brief presentation: Introduction to Immunoglobulin Treatment. Okay. So just my disclosures. So I have taken part and been remunerated for consultancy meetings, as well as doing some research with both Takeda and CSL. These are producers of the IVIG and subcutaneous products that you may be using. Okay, so before we dive into, what is HyQvia, just a bit of a background. What is IgG replacement, also known as immunoglobulin treatment? So sometimes you hear us saying IgG replacement, immunoglobulin treatment. This is a blood product that is used in people with immunodeficiency, especially those whose IgG their own IgG is low or may not work properly. So it replaces and increases IgG to the normal range in those with low IgG, or as I mentioned, that doesn't work properly. The whole point of why we want to replace it and have it work properly is to prevent recurrent bacterial infections. So currently the options for the immunoglobulin treatment, i.e. IgG replacement, is intravenous, meaning in the vein. IVIG is our shorthand for it, and that requires to be done in the hospital, usually every 4 weeks. And the other is subcutaneous, so under the skin, using a slightly different kind of IgG product, but it's still IgG and it is a blood product. And with training, people are able to do this at home, anywhere from, a couple of times a week, once a week, in some cases, maybe once every 2 weeks. Okay, so just very briefly about this, things that when we talk to patients and patients talk to us about, what kind of IgG replacement would be the best for them, and it is it's a discussion between your immunologist or hematologist, whomever is following you for your immune deficiency, whether IVIG or subcutaneous, which we say SCIg. So the pros of IVIG, it's once every 4 weeks. At the time that you're getting infused, there's nurses. So if there's concerns about your health, that can be, easily looked into. Doctor can be called. And, many of my patients prefer to stay on it as opposed to considering the subcutaneous at home because of the social aspect that it's often the same people every time they go every 4 weeks. They've sort of made a little bit of a community. So sort of their own little support network. Sort of the cons or maybe less positives, depending on the person, it needs to be in the vein. And, with time, especially if this is being done and, long term, it may be more and more difficult to get the vein, to get the IV. Side effects are more common. So what we call systemic side effects, things like headache, chills, fatigue, aches, thankfully uncommon are allergic kind of reactions to it. You do get you get a peak of the IgG and then it wears off. Although what we try to do with the dosing is to make sure that peak, stays the same, no matter whether you would be measuring either around the time that you've received the IVIG or due to the next one. So that wearing off, we try to deal with that. Less flexibility in scheduling. Yeah, you have to basically, in many of the infusion centers, go when there's space to go, as opposed to sort of having more flexibility, which you would with the SCIg. Going to hospital, parking, taking time off because of that, because it can take anywhere from 4 to 6 hours. The pros of the SCIg, really, it's sort of the opposite of a lot of the cons of IVIG. You don't need to have venous access. You do it at your own schedule. You can travel with it. Don't need to go to the hospital for it. So you're sort of in charge of your own treatment. And in some people, even though we'd really try with IVIG to make their IgG levels the same all the time, sort of what we call steady state, that is easier with the subcutaneous because you are doing it more frequently and less systemic side effects. Some cons, well, you do have to inject a few sites, usually in the pinch and inch area of the abdomen or sometimes the thigh. And those areas can have some painful injection site reactions. Again, frequent dosing, and you have to have room to store the product at home. So those are all sort of the things that we talk about, right, when we make decisions of which works best for what patient. Okay, so now getting on with the main reason why we're here. What is HyQvia? And if you look at the photo there, you see a vial, and then you also see like another little vial there. So we'll talk about that HyQvia. You have to think of it as a couplet. There's two things that are involved that make up HyQvia, and then Becky and Kathleen will go over how to infuse both of those things. Okay, so it's called facilitated SCIg or abbreviated FSCIg. So, and we'll get to why it's facilitated, but facilitation really means sort of helping, right? So this is a form of SCIg which contains a protein called hyaluronidase. And this protein makes it easier to infuse larger volumes, so larger amounts of IgG under the skin and help it also get absorbed in the body. And because of this, because you can infuse a larger volume of fluid into that area, again, commonly I'm going to say inch and inch area of the abdomen, the dosing can be every 3 to 4 weeks. So closer to dosing like with IVIG, and using 1 or 2 injection sites. It's been available in the US since 2014. Okay, so just a little bit more about this hyaluronidase. So you look at the little diagram there, that's what we call subcutaneous tissue, again, that pinch and inch. And so you have the skin, and then you've got various what we call connective tissue and fat tissue. And in that area, it's normally meant to just have a little space for something like fluid to go into. And that's what the limiting factor is about how much fluid now you can infuse with your current SCIG. So the hyaluronic acid or hyaluronin is what is sort of like a glue. It's what keeps everything there together. And that, I guess it could say, doesn't allow spaces to occur. So this hyaluronidase, this protein, it very, very temporarily opens up that area that you can see on the diagram. So it makes the space, which is normally there, temporarily, very temporarily larger. And that then lets the infusion of the SCIG to occur more easily because you're able to infuse a larger amount without getting like resistance, which you may notice sometimes when you're trying to infuse. And it also helps it get absorbed, meaning the SCIG fluid, get absorbed. Now, these effects that you see, that this opening up, as I'm saying, under the skin, these effects are totally reversible after 24 to 48 hours. And as mentioned, it's been used in the US since 2014. So that's quite a long time to monitor patients and their skin. And we can say that there are no long-term changes to the skin with the use of this hyaluronidase protein. Okay, so how does it compare in a few different ways? Well, we talked about, IVIG and what we now call conventional SCIG. That's what's being used right now. So, you see there, we talked about how often you have to do the IVIG, compare it to conventional SCIG, how many sites per month, how many infusions. ARs or adverse reactions or side effects, and IVIG. You can have some of those systemic ones that we talked about. The conventional, a local site reaction, meaning that's the area where your injection site where you put the needle in. The IgG peak levels, well, yes, they are higher at with IVIG. So peak means right after you get the infusion. But as I said, our goal is to keep the IgG consistent and in the normal range, regardless of what type of replacement you're using, whether it's IVIG, conventional SCIG, or the HyQvia. The administration, like we talked about, IVIG, you need a vein. Both the conventional SCIG and the HyQvia facilitated SCIG, you don't need a vein, right? Because it's going under the skin. The conventional SCIG, most people self-administer, they do it themselves, or they have a partner, caregiver, friend that takes part in their infusions. Occasionally, depending on where you live in Manitoba, we are lucky to have home care nurses that help out in certain situations. With HyQvia, you can sort of have again, no vein is required. People will be trained, and that's where Becky and Kathleen will do their overview about self-administration, but there is definitely teaching that is done over several visits to help teach to get you where you need to be. But also there will be supports available through company, through potentially from home care for those people that require additional assistance in administering. I know locally in Winnipeg, at some point we also hope that it will be an option in our infusion suites. And again, that may differ in different locations. So how does it compare about it working? Because that's the key. And I think the next slide will be about IgG, but just to this slide. So our efficacy, well, what do we want to do? Our goal is to reduce bacterial infections, serious bacterial infections, overall bacterial infections. And when this information was studied in clinical trials, that had to be done, of course, before Health Canada or FDA approved, the bacterial infection rate was essentially similar, regardless of whether a person was on IVIG, the conventional SCIG that's available now, or facilitated SCIG with the current brand of HyQvia. So meaning it's all modes of treatment that I just mentioned equally effective, and we can't say that overall one treatment will protect an individual more from bacterial infections than any other. Of course, there are, this is all individualized. So as I'm saying, this is sort of in general. There are patients that for whatever reason, like I said, may respond better to one treatment than another, and that's sort of the shared decision-making and information from your healthcare provider. But as an overall in the studies, they all work the same in protecting against bacterial infections. Now, what about safety? And here we're talking about majority side effects. And being an injection under the skin treatment, the most frequent is going to be local effects where you inject. 11% in the studies showed or reported some discomfort, pain, swelling, redness, redness and itching less so. But then because the study was done over a long period of time, these local site reactions decreased over time. And the overall swelling, so swelling can be the swelling right at the site, but of course, and I'll show you a photo coming up, because you're infusing a larger amount of fluid into, and I'm going to use the example, the abdomen, the abdominal area, not inside your abdomen, but under the skin in your abdomen. Yes, you will see, you can call it swelling or you can call it a pouch. Really, it's the fluid that you've infused. Systemic adverse reactions. So those, next slide. Nope. Back. Sorry, David. The slide before this current one. There we go. Sorry about that. So the gray bars are IVIG, the purple are HyQvia. And so we're looking at systemic adverse effects. So things that are not just at the skin level. So headache, we know occurs quite frequently with IVIG. So you look at headache, fatigue, nausea, pyrexia means fever, vomiting. Definitely the side effect, these systemic side effects are higher with IVIG than with the HyQvia. So what we're really dealing with HyQvia mostly is the injection site areas that may cause some discomfort, but do decrease and go away over time after a series of injections. Okay, so what do I mean by swelling at the site? So this is an example of individual there prior to infusion will be infusing in the pinch and inch abdominal area. So that's what this individual's abdomen looks at the time. This the second one, the end of infusion. So you can see the difference there and bulging. But already 4 hours after the infusion, you already see that it's starting to go down. And that means it's starting to get absorbed into the tissues and then into the blood. 24 hours, it looks significantly less. And then at 48 hours, it's very close to prior to infusion. And of course, everybody's skin is different, but that's just to give you an idea. So so 2 to 3 days for going back to what that area looked like from the outside compared to right after the infusion. And of course, very important, no clinically observable changes in the skin itself, or the subcutaneous tissue, which is the tissue under the skin, in all the various trials over 3 years, almost 3,000 infusions. So that's very important that this hyaluronidase enzyme that we talked about initially, that's was mentioned. It's very temporary of what the effect on that subcutaneous area. And you'll be told shortly by Becky and Kathleen about the rates of infusion, how fast you can infuse. And through the trial, again, almost 98% of all the infusions of almost those 3,000 were completed by individuals without having to reduce the rate, without having to, to stop and take a break for a while before resuming, or a complete discontinuation because of adverse events. So again, leading to, if there's some effects, like site reactions or maybe any other kind of side effects, they seem to be temporary, mild, and rarely required individuals to reduce rate or stop or discontinue the infusions.
Awesome. Just to say, I've just got a couple of minutes left for your time, then we'll pop over to Becky.
Okay. So how to get started? Well, of course, first of all, discuss with your treating with your treater. With HyQvia, the patient program associated with it is one path, so the same as Cuvitru. And that enrollment, similar to those that are already on Cuvitru or other subcutaneous immunoglobulin, where there's a differently named patient support program. Of course, you get the training, and that will, and also direction to transition you from your whichever current treatment you're on, the SCIg or the IVIG. And then, of course, follow-ups, just like you've been doing with same frequency as you're currently doing with your treater, reviewing everything that you normally do at your follow-up. Are you tolerating it? Any side effects? Any infections, antibiotic use, the labs, so the lab tests are the same as you would for both IVIG and your current SCIg. Okay, so who's a candidate for this? As stated, as seen there in red, any patient. It's another choice that we have now. So we've got sort of three choices, three modes of IgG replacement. So anyone who's been recommended to use IgG replacement is a potential candidate. So those that are already on conventional SCIg can switch. IVIG, those individuals may wish to switch to facilitated SCIg at home with supports. And there your frequency remains very much similar. As mentioned, in the hospitals, there might be some discussion about doing this in your infusion suites in place of IVIG, but that I guess we'll leave for the various hospitals. In some locations, home care nurses may be able to help with infusion of the facilitated SCIg in those that need some extra assistance. Okay, so you still remember this. So this is predominantly a home-based treatment, but not in all situations. You still need a pump and supplies. You still need training. You still need your lab tests done. With HyQvia, a 2-month supply will be provided to store at room temperature. So that might be a little bit different with some of the other SCIgs, but this is a choice. Okay, there's no requirement to change. It's not an issue that your current SCIg is running low or that it's not going to be available. This is a choice between patient and healthcare provider to have an additional choice to discuss.
Thank you so much. I think that was the last.
That's it. So I think that's my last slide. Yeah.
Awesome. Thank you so much, Dr. Kalicinsky. And now over to Kathleen. Do you want to share your screen? There we go. And I think you just need to put your video on. Oh, there you go.
I don't actually know how to turn the video back on. Now my view has changed now that I've shared.
Okay, no worries.
Here. Oh, here we go. No, it says the host has stopped it, so I'm not able to.
Oh, okay. You carry on. I'll try and sort your video out.
Okay, well, welcome. Thank you to David, Immunology Canada, and all the other panelists for giving myself and Becky the opportunity to speak and give information about HyQvia SCIg and the different options available for our patients. So how can immunoglobulin or Ig be given to patients? This is kind of a review and quick comparison between IVIG, SCIg, and facilitated SCIg, similar to what Dr. Kalicinsky has already gone through. I'll just kind of quickly reiterate the differences and emphasize what she's already said. With IVIG, we know that this is fast acting. It's typically given in a hospital or day medicine setting by a nurse. The monthly appointment is set by the clinic, and oftentimes these clinics are very busy. They do a lot of other infusions, and they have little ability to change the time or date. So patients tend to plan their lives around these appointments and kind of plan their vacations in between. They can last anywhere from a few hours to several hours over several days. Usually IVIG results in more systemic side effects. As stated previously, patients often need to have their infusion rate slowed down, or they're given pre-medications to help them tolerate it. With SCIg, conventional SCIg and facilitated SCIg, it is more flexible. Ig or immune globulin is given in the subcutaneous tissue more frequently, but can be done any time of the day, in the home or almost any location, provided it is clean and there's a flat surface to set up on. Or so people can also do it on vacation in a villa in Italy. It can be done by the patient themselves or a family member, maybe a caregiver that is willing. And most people can watch a show while it's being infused or kind of do things around the house and multitask if they wish. Usually SCIg is done weekly, with the entire infusion being less than 2 hours, but this is also flexible depending on their dose. Facilitated SCIg is given every 3 to 4 weeks over a few hours, but it provides a similar flexibility. So the patient is more involved in their own care with facilitated SCIg or conventional SCIg. It also means that they can have more choices. The SCIg product can come in different formats, such as vials or prefilled syringes, or large glass bottles with HyQvia. SCIg can be given in different ways, by a push method, which is just using the hands or thumb to push on the plunger of the syringe, or a spring-loaded pump that applies the pressure to the plunger of that syringe instead of the hand. Facilitated SCIg uses a more mechanical pump with a built-in program. Needles come in a variety of sizes, lengths, depending on the patient's size and amount of subcutaneous tissue. And we have the option of choosing the number of sites usually as well. So if they want to spread out their immune globulin a little bit more, they have that ability to just need some more needles. The patient tends to schedule SCIg around their life, and it's not as rigid as IVIG. So this is showing the different levels of immune globulin or Ig levels that occur in the body with each treatment. IVIG is where your entire month's dose is given all at once. So the levels or the waves are high, large, almost like a tsunami. The body uses up the immune globulin over the next 3 to 4 weeks, so the Ig levels can dip low, and the patients can be more prone to infections before their next IVIG due to those low levels. On the right side with conventional SCIg, we divide that large monthly dose into 4 and inject smaller weekly doses into the subcutaneous tissue, where the body slowly absorbs it. This results in smaller waves, more stable and steady Ig levels, and less systemic side effects. In the middle, facilitated SCIg is seen as a combination of the two. It's given less frequently, 3 to 4 weeks, so it is larger doses, similar to IVIG, but it's going into the subcutaneous tissue like conventional SCIg. It hits more like a moderate wave and absorbed similar to conventional SCIg. With conventional SCIg, we can see the Ig being injected into the tissue, and it creates more of a bubble or fluid pocket because of the natural substance we all have in our bodies, hyaluronan, which causes resistance, and this limits the amount of volume we can inject. It's almost like a mesh or matrix that keeps the connective or fatty tissue together and protects that little fluid pocket that we've injected in. And this visual is the same as from Dr. Kalicinsky's slides. With facilitated SCIg or HyQvia, patients have to give themselves that protein enzyme hyaluronidase before the immune globulin, and that breaks up that matrix and allows the injected Ig to move into the tissues instead of sitting in the pocket. So this is why larger volumes can be given. In terms of supplies, they're similar for HyQvia as for conventional SCIg, but some things are a little bit different. In this slide, what's new is shown in the blue writing. The package is larger, it's a mixed package, there's several bottles, one for the hyaluronidase and the other for the immunoglobulin itself. It's usually stored in the fridge. If stored at room temperature, it is only stable for 3 months. We still have a pump, but the pump is a little bit more involved. It's battery operated, and it has a preset infusion program. There's a pump cradle, which will go onto the pump pole, and vented infusion tubing that you use to spike the bottle of immunoglobulin, similar to the IVIG setup in day medicine. So now we'll just quickly go over what an infusion of HyQvia would look like. So the first step would be drawing up that hyaluronidase into a syringe, similar to how you would draw Cuvitru into a syringe. If your HyQvia dose comes in multiple bottles, you would draw up all of the hyaluronidase from all of the multiple bottles and infuse that first. Once drawn up, we would attach the infusion set and prime the needle as you do now with the conventional SCIg. The second step is preparing the HyQvia. So we would use the vented tubing to spike the bottle of HyQvia. You can then hang that bottle upside down on the pole. We would prime the tubing set, which just means allowing the liquid to flow through the tubing to get rid of all the air, and then load that tubing into the infusion pump. So after everything is kind of connected and set up, we can then choose our infusion sites. We would prep our skin and insert usually 1 or 2 needles. And then we're going to push on that syringe of hyaluronidase to infuse into the body at a speed of about 1 to 2 mils per minute. And usually patients can just use kind of a stopwatch to time this. Within 10 minutes of that hyaluronidase infusion being pushed into the body, what happens then is we would disconnect the syringe from the needle set, but keep the needles within the body. Then we would attach the needle set to the vented tubing set. After that, we can turn on the pump, we'll choose the right settings and basically start the infusion. And it's usually pre-programmed. If we have multiple bottles with HyQvia, maybe the dose is a little bit larger. Once one bottle is finished and empty, we would pause the pump and then change the bottle to a full one and continue on. And then once the infusion is completely finished, it's very similar to conventional SCIg. We would just complete the infusion, turn the pump off, remove the needles from the body, bandage up the sites as normal, clean it up, dispose of all the materials as would be taught by the nurse, and record the infusion as well. So that's kind of a quick overview. Now the training sessions to start facilitated SCIg versus SCIg, this is just a quick kind of bar graph comparison. It shows the number of teaching sessions per person for self-administration for conventional SCIg and facilitated SCIg. With the orange bars, usually conventional SCIg is taught in about 2 training sessions. The purple bars show facilitated SCIg or HyQvia requiring 3, 4, or 5 training sessions, and this is largely due to a ramp-up period we'll talk about later. As always, patients can request more sessions to ensure that they're comfortable and confident in what they're doing and receive the adequate training. So this table kind of illustrates an example of a ramp-up period for HyQvia before reaching for a full dose. So you can see at the first week or the first infusion, they're only administering about 25% of the full dose. The second week or the second infusion, we're giving about 50% of the full dose. And we move up in steps until we reach the full dose at week 7 or the 4th infusion. After this, the patient can infuse their full dose. They feel comfortable and confident about every 3 to 4 weeks. So in addition to the ramp up of dosing, there's also a ramp up to full speed or the rate of the infusion. The middle section we blocked off because it showed pure pediatric doses, and we just believe that most people were looking at the adult results. Similar to the ramp up in dosing, you can see that here with each infusion, it started slowly, only at about 10 milliliters per hour for the first 10 minutes. And then the pump, using the preset program, it will increase the rate slowly in steps every 10 minutes, usually for about a total of 40 minutes. At the 50-minute mark, we reach the maximum rate, which can continue for the remainder of the infusion. So other differences with conventional SCIg and facilitated SCIg are the maximum rates in which we can infuse. With SCIg, the maximum rate is usually only about 60 milliliters per hour, or if you're using Hizentra, slightly less. The max volume is 50 to 60 milliliters per needle site, depending on the brand as well. With HyQvia, the rate of infusion and volume are both quite a bit higher due to that initial pre-infusion of hyaluronidase, breaking down the matrix of the tissue, allowing for that immunoglobulin to permeate the tissues instead of sitting in a pocket like conventional SCIg. Where we inject is a little bit different as well. The orange areas are usually where we can infuse SCIg, that whole pinch and inch kind of idea. With HyQvia, the recommended areas for infusion are going to be the upper abdomen or the upper thighs. This allows for that higher volume of fluid to spread out. And usually this tends to go lower and drop down due to gravity. So for example, if we infuse HyQvia into the lower abdomen, we run the risk of that HyQvia fluid spreading into the hip space, which can become uncomfortable. So that's why they recommend kind of upper abdomen or upper thighs. So with conventional SCIg, we all are kind of familiar with some of the localized side effects, the swollen fluid pockets. They look more like lumps or golf balls, maybe some itching, redness, and warmth. And this all tends to go away within 48 hours as the body absorbs it. With facilitated SCIg, we can kind of see in these similar photos. So before the infusion, you can see his abdomen, it's quite muscular. Right after the infusion though, instead of seeing those little lumps, golf ball size in kind of each individual area, you can see that fluid is more spread out. It is quite swollen, but it's more like a pancake as opposed to little lumps or grapes or golf balls. And then 24 hours after the infusion, you can see that there still is a little bit of swelling, but that swelling has gone down. That pancake is flattened out even further as the body is absorbing it. So with the local reactions, about 96% of our conventional SCIg patients report mild local reaction or side effects. With facilitated SCIg, you can see that the majority are still reporting mild side effects, but with about 25% reporting moderate side effects. And these again go away within about 1 to 3 days. So just some tips for managing facilitated SCIg infusions. Choose an infusion site opposite to the side that you like to sleep on. So for example, if you like to sleep on your right side, maybe you infuse more into the left, and then when you're laying on your right side, that fluid will kind of disperse and kind of spread out with gravity more onto the right side. Immediately after, we recommend that you don't stay seated for a long time. It's a good idea just to maybe go for a walk, but avoiding any strenuous activities. So we don't want extreme sports or any crazy kind of activity, but we do want you to move around and not just stay stationary as well. Plan to wear loose clothing throughout the next day. If there is leaking, similarly to conventional SCIg, we recommend putting mild pressure on that site, maybe resting on the side with the infusion side up for about 15 minutes. These are some questions and considerations for you and your provider or your physician. There is a little bit more of a swing in immune globulin levels. Are you able to tolerate this and still keep your infections down? Or are you finding even on conventional SCIg, you're feeling run down by the end of the week? Then this option may not be for you. The training can be more involved with the ramp up, as you guys saw. Are you willing and able to learn all the steps? Do you have, maybe family or caregiver support? And then keep in mind that afterwards, after the training, the infusions are only monthly. So it could be some patients might find it more difficult to remember it from month to month as opposed to week to week. The product is only stable for 3 months out of the fridge. So if you're someone that likes to travel south for the winter, and maybe you're gone for 6 months at a time, would you have to come back more often to get the product? This is just dependent on how the SCIg clinic is run in your local area. And these are just some examples to consider. We encourage you to speak with your local SCIg program or your provider just to see which treatment is the right for you and would be the best option. And that's it. Thank you so much for letting us present. This is kind of our SCIg Home Infusion contact info for Becky and I, if anybody has any questions. And we just help with the SCIg clinic that is run in Southern Alberta.
Awesome. Thank you so much, Kathleen.
Thank you.
Awesome. And could I just ask the panelists, could you also put your videos back on? That'd be great. And yeah, 2 really great presentations that went into a lot of details. We've had a few questions already submitted and some that came in live. Over to you, Dr. Grenier and Andrew, just to maybe just mention about how CBS is involved in the process.
For sure. Thank you, David, for this. So Canadian Blood Services is responsible to supply and provide safe blood and blood product for the Canadian population, and we're doing that on behalf of the provincial government. Immunoglobulin being a protein that is extracted from plasma, and we find plasma in blood, makes it really appropriate for CBS to be the distributor and manager of this product. The way we were involved is on behalf of the provinces and territories, we partnered with CADIT, the Canadian Association of Drug and Technology Health Assessment, to review HyQvia, which was a new product coming on the formulary. And through that process, we got a successful review and submitted it to the provinces and territories, which approved the product to be reviewed, to be listed. So CBS is then now distributing this product on behalf of all provinces to the blood banks for patient use.
Thank you. And the one question we had was how does plasma donation help patients?
Well, because immunoglobulin, it's one of them. There's more proteins that you can find in plasma, but immunoglobulin is definitely the protein that is the most in demand coming out of plasma. So globally around the world, there's not enough plasma collected to produce the immunoglobulin that is required. Now in Canada, there's no shortage. There's no risk of shortage in the short term or even long term. We have the contracts according to this, but still Canadian Blood Services doesn't want to wait until there's a risk of shortage before we move forward with a solution. This is why we're opening more centers to collect plasma, and we have an agreement with a partner called Grifols, which will also collect more plasma to produce immunoglobulin. So we have more immunoglobulin available coming from the Canadian market to be made available for patients.
Awesome. Thank you. So we got one question came in, and so what I'll do is I'll just float the question out, and Dr. Kalicinsky, I think it's more focused on sort of treatment training. So decide who amongst you wants to answer, and then you can always add. But who should switch from Savitru to HyQvia? If it is a recommended treatment for individuals, how will the transition be done?
Well, maybe I'll sort of answer the first part and then the whole part of transition, and then I can maybe pass to Kathleen or Becky. So, as mentioned, it's a choice. So, I think each of you, this is to give you a bit of information, and then your next appointments with your treaters, you can bring up if you're interested in it. I guess it was, options, some of those, and I think it was in Kathleen's presentation, that the training is a little bit more involved. However, in Alberta, you've got Kathleen and Becky, Saskatchewan and Manitoba, we've got one path, so they will be there during that ramp up when you're having to, those the week 1, week 3, and etc. That's when the nurses will be there teaching and doing that ramp up. So the support is there, but there's a little bit, maybe a little bit more to learn. But again, support is there. So it's though, and so there are several patients that want to, rather than do weekly, prefer to do more frequent, less frequently. So that, those people may be an option. Those that may want to switch from IVIG to facilitate SCIG. Some people did not want to switch to conventional SCIG because they didn't want to do something every week. They preferred something less frequently, hence IVIG, but now this is a choice for those people. So I think overall, everyone has their own sort of circumstances and nuances, and speaking to your treater, because those kind of discussions, your treater knows you the best. But if you're wondering whether you should switch, that's the conversation to have. Again, you don't have to switch if everything is going well. And you're happy with what you're doing, you don't have to switch. It's just another choice. And I think I'll pass it to Kathleen or Becky more about the training part.
Sure. I think to add to that, as Dr. Kalicinsky said, there really isn't a health benefit to do this, to need to. It is the same treatment, just different in terms of giving that dose all at once. So as Kathleen showed, make those considerations as to whether you're interested in taking on the different workload, and whether you think that your body can tolerate having that more of a moderate swing in immune globulin G levels as time goes on. If you and your provider decide that you do want to pursue this treatment, if you are currently on SCIg, what will happen is your doctor will submit an enrollment form for you to receive training. You will use up all of your current SCIg, whether that's Cuvitru or Hizentra. And then at the time that you would be at the end of your home supply is when the training for HyQvia would start. And it would include that ramp up procedure that Kathleen showed. If you are currently on IVIG, then you would be enrolled by your provider. And around the time of your next IVIG appointment is when the training for HyQvia would be coordinated. So that way we make sure that your body has the immune globulin it needs over the next period of weeks as you build up your subcutaneous levels of immune globulin through the HyQvia treatment.
Awesome, thank you. And I want to another question that's come in. If you're receiving a large quantity of IVIG over 2 days, can it all be infused in 1 day, or will it still be done over 2 days?
If I can take a stab at this, so there are a number of patients who, you know, in your situation as you're describing, the person who asked the question, with higher doses of immune globulin that are needed for conditions like myasthenia gravis or other neuromuscular conditions. Sometimes people require it for rheumatology or skin conditions. Very often, those are the larger doses of immune globulin. And they're very often given over a period of a couple of days, spread out over longer time, because those are larger volumes and because when it's given intravenously, that causes those full body side effects. Now with SCIg, when a person is on conventional SCIg, they're still getting that same dose in grams, but it's made smaller, given once a week. And a person isn't likely to have to need to spread that out over days because they're taking it in through their body fat. That chance of a full body reaction is much, much lower. The same thing would occur with HyQvia. Because this is being given subcutaneously, even if you're getting your full dose once per month or once every 3 weeks, you would not likely need to spread that out over 2 days because that chance of a full body side effect is lower. It's not going into your blood so quickly and directly, it's going into your fat. However, the difference is with dosing. And if I can jump and answer a question that I can see that's just a couple ways away, that asks about Cuvitru and the volume, whether your dose would be the same. Your dose in grams stays the same, but what's different is the volume. As Kathleen and Dr. Kalicinsky showed in their slides, the SCIg in this treatment is a 10% solution. It's not as concentrated as conventional SCIg. The reason for that is because they started developing this product before they started developing Cuvitru. But what you can do to figure out your dose is to take your weekly dose of conventional SCIg in milliliters and multiply that by 4. That will give you your monthly dose in the SCIg concentration. But then you need to take that dose and multiply it by 2 to get the 10% weaker concentration that HyQvia is. So yes, it does create that large volume, but remember, it's not going to pop out like a bowling ball. It's going to spread out like a pancake. So with that and a higher dose like myasthenia gravis, you know, patients who take higher doses, that is a reason why some patients might not be able to do HyQvia every 3 to 4 weeks. If your dose is high enough, because of those limitations with how much we can put in per pocket, per space, you might need your HyQvia every 2 weeks in order to get all of your dose in averaged out over, say, a 3-month period. So it really depends on the size of your dose as to whether you can comfortably do it every 3 to 4 weeks as opposed to maybe more often.
And I'll just further that. Oh, sorry for the question. The question that was asked in the Q&A was if you're on Cuvitru 60 milliliters per week. So that conversion would be 60 times 4, 240 milliliters per week. And then we actually have to double it because of that concentration. So the total for HyQvia would be 480 mils, which does seem like a lot, like 2 cups worth. But on the slide, it showed that the one site, you can actually put in a maximum volume of 600 mils. So with 480 mils, it'd still be with needle site. And what happens is, as Becky said, it would kind of bulge into a pancake and have that fluid spread out, and your body would absorb it similarly over the next 1 to 3 days. It seems like a lot, I know.
Thank you. Dr. Kalicinsky, did you want to add anything there, or you?
No, I think that, no, I think all that information, I think I would help to answer those the questions. I have nothing to add.
Yeah. And just to say, I know we're coming up to the end of the hour. If people do have additional questions that they want asked, we'll always take them in, and hopefully the panelists, we could send a few to you and hopefully get some written ones back to you. Is there a max amount preferred for pocket size? With that question came in. Oh, Becky, you might want to unmute.
Yeah. So as shown in the slides, so whereas your maximum pocket size in conventional SCIg is 50 or 60 milliliters, depending on the product that you're using, whether it's Hizentra or Cuvitru. With HyQvia, the maximum pocket size was shown is 600 milliliters. Now, keeping in mind, that's not a tidy pocket like the way it is with conventional SCIg, but it spreads out through that tissue because of that pre-infusion of hyaluronidase. So in this case, with HyQvia, 600 milliliters is the maximum amount that can be given through any one needle site. So when you do the math with maybe your conventional SCIg dose, if you realize that your total dose is over 600 milliliters, then yes, you would need to use 2 needle sites to spread that out.
Thank you.
Just Becky, did you also want to, because you were explaining it so well, that's why I don't want to get into, add my bit there, but in those, can you just also explain to those who may be currently doing IVIG and switching over to facilitated SCIg and where how the concentration relates there?
Absolutely. So this is where the concentration of HyQvia is a 10% immunoglobulin solution, and that is the same as IVIG. So essentially, the company Takeda took their IVIG product and turned it into HyQvia. So if you are on IVIG infusions right now, what you can do is you can ask your infusing nurse what your dose is in milliliters. And then what that dose is in milliliters, that once a month or once every 3-week treatment you get, that would be the same with HyQvia.
So thank you. And one last question. What if I have unusual side effects? Who do I report these to? And are there any that mean I should stop taking HyQvia?
Well, I'll start with that one. Definitely let your provider know, your provider's clinic, nurse, your provider definitely needs to know. And also, if the training is through OnePath, letting their nurses know. If you're from Alberta, then I guess I'll let Kathleen and Betty take that. Becky take that one as to who do they contact, in addition to their treater.
I would just say it depends, right, on the side effects and where you're infusing the SCIg. So yes, for sure, the provider, the physician, and then if there is a SCIg clinic or the OnePath patient support program, either one of those. But the best thing to do is really just to take a photo of the area. I always tell all of my patients this. Everybody describes a rash or something differently, it can be subjective, whereas if you kind of make a mental note, well, what time did I infuse? I infused at about noon. At 6 p.m., I'm noticing something funny. This looks different. Maybe it's a rash, a blister. Just take a picture with your phone, and this way you've got an objective kind of piece of information, regardless of who you're showing it to, if it's your physician or your provider, the one-path patient support program, even if you're, going into an emergency and showing the physicians there, they can kind of clearly see, well, I infused HyQvia or whatever you're infusing at noon. At 6 p.m., 6 hours later, the area looked like this. Maybe you're monitoring it for a bit. Maybe you're looking at it the next morning. Take another photo at 6 a.m., then it's 18 hours after infusion, and you can kind of track the progression, and it is objective.
Thank you. And just very quickly, can everyone see my screen being shared at the moment? Is that, before we wrap up, let me go into this again, sorry.
No, it's not showing, Dave.
Oh, thanks. Give me 1 second. And I don't know, I saw one whilst I set this up. Someone said that I just wanted to point out that a benefit of this is less needle sites. I know many patients struggle with scar tissue at needle sites. Just wondered if anyone wanted to comment on that.
Yes. Okay, go ahead, Becky.
So I was just going to say, so with training to learn how to do conventional SCIg or HyQvia, your infusion nurse who does the teaching will certainly talk to you about moving your sites around so you're protecting your skin. So we don't want you to infuse week to week in the same quarter of your abdomen. We want you to move that around between your thighs, maybe your back of your hips, your arms, if those are an option too. So it is important to keep in mind that even though you're doing less infusions with HyQvia, you are limited to only that upper abdomen and the thigh spots. So while you're using less needles, you have less sites to choose from, but good site selection, moving your needles around week to week or every 3 to 4 weeks, as you are taught, should be the key to really protecting your skin integrity. Diabetics who give needles every day are certainly at more risk of seeing skin issues. And so that site rotation is very important and would be taught to you in training.
Awesome. Thank you so much. And yeah, just to wrap up, I just want to thank everyone who attended today. And thank you so much to our presenters and panelists for answering all of those questions. And a big thank you again to our sponsor, Takeda, who help us put on these events for our members. And just to say that we will be following up with a recording of today. Very short survey to see how we can improve our events. And if we do get some additional questions in, we'll try and get them addressed for you. And if you don't already, please follow us on social media so you can hear about events like this. Whether you're a patient, family member, or health professional, membership is free. And for members and non-members alike, it's always good to sign up to our What's Happening, and that lets you know about all the events coming to your area and what we're doing online. Yeah, and the website, it shows any opportunities that you can get involved as a volunteer. And that's it from me. Again, a huge thank you to all of you who were panelists today. I hope you enjoyed it as well. And yeah, we'll see you all again soon. Thank you.
Thank you.
Thank you, everyone.
Thank you,
Bye.
and thank you everyone for in the audience for participating and being here with us today.
So, thank you.